Mr. Alan Markov is the name of the patient. Otitis externa is the case. This is a grand master class writing workshop for the regular students. Hello and welcome to Seven Sentinels. This is Grand Master Class and I am Peter Simon with you. Yes, we have 40 minutes of session now. And in this 40 minutes, we are going to do this session. Mr. Alan Markov, specifically for nursing. And in general, it is for all the 12 professions because it is one and the same for all the professionals. Yeah. So there we are. This is the case. Here it is. Now, this is lecture notes. Lecture notes. Now let us see here. You are a nurse. Okay, 20th July 2019. This is today's date. Okay, this is today's date. So this will go. Yeah. So copy text. Yeah, 20 July 2019. That is today's date. So date will come here in the second part. And before that will be the address. Where is the address? Address is here. You will write the letter to Dr. Cyril John, local general practitioner, the Hale Land Medical Clinic, Auckland and New Zealand. Yeah. So you are writing this letter to Dr. Cyril John. Copy text. This is the first line. Next one. Local general practitioner. Then the Hale Land Medical Clinic. Auckland. New Zealand. Yeah. So local general practitioner. Local general practitioner. Hale Land Medical Clinic, Auckland, New Zealand. Yeah. So this is the first one and this is the second one. So right. Address and the date. Now salutation. You write dear Dr. John. That's it. Comma. Subject regarding what? Okay, call me to the local GP to visit holiday resort to consult immediately. So this is emergency letter. Immediately. Immediately. Right? So emergency visit and formal diagnosis and management. Okay. Now see here very carefully. Right? So here you can see immediately. Call me to local GP to visit holiday resort to consult Mr. Almork immediately. So it's an emergency case. It's an emergency case. You can see. Okay. Right. Fine. So next, you are a nurse. So regarding what? Regarding Mr. Alan Marco. Regarding Mr. Alan Marco. And date of birth, is it given? No, age is given. Age 38. Aged 38. Yeah. So Mr. Alan Marco, aged 38. Mr. Alan Marco, aged 38. Yeah. Yeah, see that all the students come for the class. Send to everyone, all the groups. Ishwant, send to all the groups the links. Okay. Send to individual students also. Right. Now the body of the letter will be there. The body. In the body will have 5 paragraphs. A, the introduction. B, the main body paragraph 1. The main body paragraph 2. The main body paragraph 3. The conclusion. Now next one. Yours name is already known, John. Yours sincerely, comma, and leave 2 lines here. Leave 2 lines here. Yours sincerely is a nurse in a holiday resort. You're a nurse working in the holiday resort. So, nurse, and it is in Bayline Road. Nurse. Okay, you are a nurse. You are in a holiday resort, and it is in Bayline Road, and it is in Auckland, and it is in New Zealand. So, nurse, holiday resort, Bayline Road, Auckland, New Zealand. Yes. So, nurse. So, resort nurse. Resort nurse. Or nurse. Whatever. So, then holiday resort. Okay. Holiday resort. And next one. Bayline Road. Bayline Road. Bayline Road. Bayline Road. Next one is Auckland. Then New Zealand. So that's it. So these are done. So 5 different things. 4 plus 2, 7 over. First one is address from here to here. Then the date, salutation, subject line, closing remarks, and your personal address. Finished. 5 paragraphs are there. How are you going to do these 5 paragraphs now? Okay, 5 paragraphs. Right. So now we'll go into the body, the introduction. Yeah. Now, to whom are you writing? To whom are you writing this letter? So the body of the letter we are going to write. First, we'll start with the introduction. Okay. Mr. Marco, comma, who? Mr. Marco, who? Now, what is the problem related to him? Okay. So, came for a holiday trip. He was diagnosed with localized right external ear infection and uncontrolled blood sugar levels. Okay. Localized right external ear infection and uncontrolled blood sugar levels. Okay. These two things. Right. Diagnosed already. Or who has been presenting with the complaints. So this one you can write. So anything is okay. Right. Now let us see there. So diagnosis. This is the diagnosis. Okay. Yeah, this is the diagnosis. So localized right external ear infection and uncontrolled blood sugar level. Or presenting complaints. This also, anyone you can take, that or this. Okay. Same thing repeated here in a different style. That's all. So you can make your introduction. Then what he requires. What does he require? Diagnosis, local raised, okay, increased water, unstable blood sugar. Here also it is the same thing. You can see here. Diagnosis. Okay. Same thing repeated here. All right. So go through this. The next one, what does he require? So immediately, emergency. Emergency. Okay. Consultation. Emergency consultation. He requires emergency consultation and he requires formal diagnosis and he requires management, appropriate management. Now you can understand here. Mr. Marco, who was diagnosed with what? Okay, Mr. Marco, who was diagnosed with? 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 Right. doctor. 1 month doctor. Okay, check the xe.com. xe.com. Yeah. Right. Who was diagnosed with? Who was diagnosed with? So here, Mr. Marco, who was diagnosed with? Take a screenshot. Yeah, Mr. Marco, who was diagnosed with? Diagnosed with what? See there. Okay. Localized, right? Okay. So this one. Mr. Marco was diagnosed with localized right external ear infection. Mr. Marco was diagnosed with localized right external ear infection and uncontrolled blood sugar levels, comma. Okay. Requires what? Is this the referral letter? Check there. Nothing is given, so just leave it. Requires what? Emergency consultation, formal diagnosis, and appropriate management. These three things we'll write there. Nikhil, Vishwant, and Sumesh. I want to send the messages to each and every student. See that they will come. Okay. Starting the classes, no? Try to see that everyone will come. Make something personal message you send up. Call them if they are serious. Okay. So requires emergency consultation, comma, emergency consultation, immediately consult, emergency consultation, formal diagnosis, and appropriate management. Okay. Appropriate management. So here, call made to local GP to visit a holiday resort to consult. So here, visit holiday resort. Emergency consultation at the holiday resort. At the resort, he has to come here. Emergency consultation at the resort, formal diagnosis, and appropriate management. Okay, that's it. Right. Full stop. So that's it. Introduction is done. Now, body paragraph 1. So, body paragraph 1. Now, what will you write here? You'll write about, okay? Yeah. Write about them. Okay. So, write about, introduce them. Introduce them, why they came, what they are doing, their history, background, all the things you can write in the beginning. Okay. Then next, try the medical history and medical condition till now. And next, what is required? Okay. So you can see here, treatment. What treatment has been given here? Okay. So this is important. You can write this in second paragraph. Okay. So first paragraph, write about all the histories, personal things and other things. And next you have to write what you have given treatment so far here. And next what they have to do. Okay, after they come. So all these things are there. Yeah. So how to write the sentences? What are the sentences that you can write here? Alan Marco. Now let us check some sentences. What type of treatment you have given? Recommendation for the GP, what he has to do. So this will go into body paragraph 2. Body paragraph 2. BP2. Main body paragraph 2. Main body paragraph 2. Okay. Main body paragraph 2. Right. So other histories, social history, okay, another history, all those things in first paragraph you can write. And this recommendation for GP, you can write in MBP 3, main body paragraph 3. There you can write. Right. Next, histories. You can write in body paragraph 1, main body paragraph 1. Okay. Based on this one, you can schedule your letter. You can schedule your letter based on this one. Okay. Now let us see here. Right. So what about him? Tell about the patient. Tell about the treatment. Tell about the post doctor's visit. So before doctor's visit, what you did? Earlier, what the patient did? First paragraph, patient. Write about the patient. First paragraph, main body paragraph about the patient and the histories. You can write. Main body paragraph 2. Based on this one, the treatment. Here you can write about the nursing management. Okay. Nursing management. Okay, what did you do as a nurse here? Then here, the doctors, okay, action. So this is future. This is present. This is present, and this is the past. I think you understand very clearly now. So past, present, and future. Past means tell about the history and other sources, other information related to the patient. Next one, presently. Once he came to your custody, what you are doing, the nursing management. And third one, the main body paragraph 3, that is doctor's action when he comes here. Okay. All these things will come in this paragraph like this. Right. Introduction over. Fine. Then the patients. Okay. The conclusion. Okay. So conclusion will come here. Here you'll say, based on the aforementioned circumstances, comma. So we'll tell that one. So here, patients and the histories of the past. How to develop these sentences? Introduction over. Now body paragraph 1. What are the things you want to write where? You can check there. So here, self-inserted cotton swabs to clean the ear. Right ear pain for 5 days. Medical history. Taken paracetamol, which is ineffective. Okay. Paracetamol was ineffective. Flushed with water inside there. This you can write the past. Then here, all the vitals were taken normal. 98 beats per minute, 37 degrees temperature, BP 120 by 80, everything is fine. Then ear canal, swelling and redness. Swelling and redness. So this is the history, medical history. External ear redness and without ear discharge, tympanic membrane, pale green color. All these things will come in the first paragraph. The next one. So treatment, what treatment is given? Advised to take over-the-counter medications due to ineffectiveness of paracetamol. Okay. Advised to take the over-the-counter medications due to ineffectiveness of paracetamol. Started ibuprofen for mild pain. Advised to refrain cotton ball insertion and swimming. Monitor blood sugar levels regularly. Increase insulin level if high. So these points you can write. Okay. Right now let us see here. Okay. So copy text. Okay, this is nursing management. That is number 1. Point number 1. Okay. That is bullet point number 1. Yeah. Right. Next one. Started ibuprofen for mild pain. And then advised to refrain from then monitor blood sugar level regularly. So here it is. So 4 points we have got here. You can write these 4 points here. Okay. The next one. Here, past history. Then here, doctor's action. So doctor's action is here. Okay. Consultation for formal review, insulin injections, pain management for pain relief. These are the things. Okay. So number 1, consultation for formal diagnosis. Next, review insulin therapy. Then next, pain management for pain relief. Yeah, these are the 3 points we have noted down here. Afterwards, we can add if anything is needed. And this is patient and the histories. So what is the patient here, histories? Now let us see here. Right. Next. Here you can see. Okay. They are on a holiday trip. This is a holiday trip. came to Wellington Island in New Zealand, came for a holiday trip. Okay. Okay, accountant at Wellington Island. Accountant at Wellington Island is an accountant. Is an accountant. His professional history is an accountant. Number one. If you think that it is needed, you write. Otherwise, leave it. Is an accountant, and he came on a holiday trip with his family, with his wife. Sorry. Okay, for 2 weeks. 2 weeks holiday trip. He came on a 2-week holiday trip. He came on a 2-week holiday trip. That's it. Next. He likes scuba diving and regular swimming. Scuba diving and regular swimming. Scuba diving and swimming. Scuba diving and swimming. Okay, scuba diving and swimming. Next. So he came for 2 weeks. Now he has earache for 5 days. In the result for the past 2 weeks, already 2 weeks over. 2 weeks he has been staying there. Okay, 2 weeks he has already been staying there. Now for 5 days, this week only he had problem. Severe earache for the past 5 days. And pain scale at 4 out of 10. And unstable blood sugar levels. Okay. The next one, what did he do for this? Already we reported in the introduction itself. Taken paracetamol, ineffective. Paracetamol, which was taken for pain relief, was ineffective. So you can say like that. Paracetamol was taken for pain relief. Ineffective. 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 The next one. So paracetamol was taken, ineffective. And what did he do? Self-inserted cotton swabs to clean the ear. Okay. This is the second point. How you are going to modify and write, you can. Next. Flushed with water inside the ear. Flushed with water inside the ear. Yeah. Now, so what are the other things you have here? 20th, on 20th, you had examination. You had an examination and vitals. All the vitals, were they remarkable or unremarkable? Vitals revealed what? Vitals revealed what? All the vitals were revealed what? So this nurse management here. Okay, vitals revealed or confirmed what? Okay, the next one. Right ear hot while touching, tenderness and palpitation. Right ear hot while touching. Upon auscultation. What do you say? Auscultation. Let us see the meaning of this word auscultation. Auscultation. Can we use this word? Auscultation. At auscultation, basal for cracking wells. Auscultation. Okay. Auscultation. The act of listening to sounds arising within organs as an aid to diagnosis and treatment. Keeping your ear and checking, or keeping the stethoscope and checking. The act of listening to sounds arising within the body organs as an aid, such as lungs, to diagnose and treatment. That is called auscultation. So, right. So here, nothing is there regarding that, hearing anything. So you cannot take that word. So right here, hot while touching. Upon examination, you can say redness. Examination. Vitals, then examination. Examination, what happened? So swelling, redness, pulp, tenderness, hot, tenderness, swelling, and redness. Okay, redness without ear discharge, tympanic membrane, pale green color. So this you can take. So hot, on examination it was hot. Next one is tenderness, tenderness. Then what? Tenderness, swelling, and redness. Swelling and redness. So because of all these things, you give treatment. The next one, tympanic membrane, pale green color. So pale green color. Tympanic membrane. Tympanic membrane, pale green color. So next is swelling. This you can write in the next line. Hot and tenderness and palpitation, ear canal, swelling and redness. Tenderness. So this is ear canal, swelling and redness. Then tenderness and palpation. Palpation. Okay. So these you can write. Okay. These you can write. Now smoking 10 cigarettes a day, try to quit but unsuccessful. This is social history. You can write here in the beginning. Okay. So smoking 10 cigarettes per day, 10 sticks per day. Okay. Cessation, unsuccessful. Try to quit but unsuccessful. Smoking cessation, unsuccessful. Okay, smoking cessation, unsuccessful. So you can write like this. So this is the way how you can. So this is body introduction, body paragraph 1, the patient and the histories, all this you can write. And then nursing management. Okay. So what happened you will write. Then you will write about future, what the doctor should do. And then based on conclusion, based on the aforementioned circumstances, urgent assessment, okay, a visit to the hospital, on an urgent basis, emergency evaluation, immediate assessment or evaluation, and recommending a necessary plan of action, recommending necessary plan of action, appropriate management would be profoundly beneficial. Full stop. In case any, don't write into a new paragraph, write it here only. In case any additional information is deemed extremely relevant. Please do not hesitate to contact me. Full stop. So this is it. So what I'll do is I'll take all this information and put it in the Telegram channel, or I'll put it here. Okay, this is too long. Okay. So I'll put it in the Telegram channel. You can just take from there. Okay. Yeah. So this you can put it in the WhatsApp also. I'll put it in the WhatsApp also. I'll send to the staff members. They will just post it in the groups. You can collect it from there. Yeah. So staff. Yeah. So right. So I have put there. They'll post in here also. Telegram channel also I put. Copy post link. So this is the link. Okay, you can take the material from there and you can prepare your letter and you can submit this letter. All the students are requested to submit this letter without fail today. Right. So Rajeshwari Ram Sarvegar. You remember? Huh? You wanted to follow, no? Rameshwari. Rajeshwari. Yeah. You can contact her. So whoever is interested, you can contact us. So we have extended the special option. Right. That's nice. Everything clear. Have a nice day and we'll come with the session shortly. Rajeshwari Ram Sarvegar. You told me, no? Sir, please. Somebody sent me Ramesh Rajeshwari. You are. Follow it up. Okay, I'm free now. If she is interested, you can contact me. Talk to her and get in touch with me. Okay. All her doubts, whatever doubts they have, they can clear. Yes, that's the end of the session. Have a nice day. Bye-bye. So correct, write this letter. So all of you. So write this letter and submit to me and I'll be correcting your letter. So every day, regular basis, we are going to have writing session. Every day one lecture will be given and one letter will be corrected. And in the same way, morning writing, speaking session is over and the speaking session will be conducted. And in the evening, you'll have listening and reading also. So every session will be there every day on an alternative basis. Monday, reading, listening, writing, speaking, they will go like that. And every morning, if it is morning reading, then afternoon listening, then evening writing, then speaking, like that, 4 sessions. But every group, morning batch, afternoon, evening, everyone will get these sessions on a daily basis. So whoever is interested, you can attend, and we have given this, Grand Master Class special scholarship for 60%. If anybody is interested, we are extending for another day, so you can join today.